Good morning. Welcome to the Community Calendar. I'm Jazze, and today my guest is Dr. Carolee Estelle. She is the Interim Medical Director for Infection Prevention at Parkland Health and Hospital System, and she's also the Assistant Professor of Medicine, Infectious Diseases, and Geographic Medicine at UT Southwestern Medical Center. Ooh, you have a lot going on. Thank you so much for joining me today because we have a lot to talk about.
Absolutely, and thank you so much for letting me be here and chat with you and talk to your audiences.
Yeah, so let's talk about the flu shot because the coronavirus has really just outshined, I mean, you can't say shine, but overwhelmed us, right? I mean, it has affected our entire lives. Everything is shut down due to the coronavirus. Some people are forgetting about the flu, and the flu shot is out there for people to take. Tell us why it's important for everyone to get a flu shot, especially now since we're dealing with the coronavirus pandemic.
Yes, it is always important to get your flu shot every season to protect yourself and your family and your friends from the flu as well. And this year in particular, with COVID-19 pandemic occurring at the same time, you know, it's even more important that we protect ourselves and do whatever we can to help keep ourselves healthy and safe. Just to stay healthy and safe, but also because, you know, with every increased use of our health system at this time when it's already overwhelmed for even necessary things, it further strains our ability to do that. So it's we want to keep people safe always from any disease, but also because we need people to be healthy right now.
Absolutely. So is it too late to get the flu shot? When is the last date, I guess, you know, for you to get the flu shot?
You know, there's actually it's never too late. There's no real end date. Our flu season is typically, well, it usually peaks in December, February timeline, but our sort of big, broad, overarching range of when it can be is really sort of October through March type of timeline. And it takes about 2 weeks for your body to develop those antibodies, so to start having the protection from the flu vaccine. So our general recommendation is that at the end of, you know, to get it by the end of October so that you can have it before circulation happens in your community. But anytime before circulation starts is good. But even if it's after circulation starts, it's a good idea to get it. So now is not too late. And the other good news is we haven't started seeing really high levels of circulation of the flu in our community yet, so it's definitely not too late yet.
Yeah, well, that's really good. I will say I did get a flu shot, and I made sure my daughter got one. So we took care of it quite some time ago. I'm not an anti-vaxxer. So I have a lot of people who are like, why did you get the flu shot? And I got it early. And the reason was because I'm thinking, well, all this coronavirus stuff is going out, and I don't want to get sick and confuse the symptoms, or maybe even have them both and compound the problem. And so let's talk a little bit about the symptoms of the flu and then the symptoms of the coronavirus. How are they different?
Yeah, so that is a really good question. And the answer is they are very much similar. So both COVID and the flu cause fevers, chills, cough, shortness of breath, and difficulty breathing. It causes like muscle pains and feeling really tired, and all of these things. Also, COVID can also cause nausea and vomiting and diarrhea. More rarely, occurs more frequently in younger populations than older. Flu can actually also rarely do that as well, so both can do that. One of the actually biggest, I'd say, distinguishing symptoms is the loss of taste and smell that can happen with COVID rather than flu. So that's one of the sort of unique symptoms that COVID has. But otherwise, it really has very general symptoms that can occur in both the flu and COVID. And that's why you should, during this season when it's flu, if you develop any flu symptoms, you should be tested both for the flu and COVID at the same time.
Right. That's crazy that you can actually get both at the same time. Right. And it's like, that's really hard, you know, to handle on your body if you were to have both illnesses at the same time. So if someone was interested in getting a flu shot, where could they get a flu shot, and what are some of the after effects that the flu shot can have that people are so worried about if they do get the shot?
Yeah, so you can go to Parkland. Parkland has flu clinics and the like. There's also, I think, a number of flu drives around the community and other locations if any of the Parkland locations aren't as convenient for you. So that's where. And then what are the symptoms that can happen, or the sort of side effects that can happen? So it's important to remember what a vaccine is doing. What a vaccine is doing is it's delivering essentially a picture, kind of, so to speak, a picture of what this virus is and what it looks like, so that your immune system can know what that is and start learning how to create an immune response and learn how to attack it, so that the next time it sees it, it knows what it is. So it's totally normal and expected to have some symptoms after you get a vaccine, really any vaccine, that are similar to the symptoms that can happen. So some people will get, you know, so you'll get the pain at the site, you know, sometimes you'll feel really tired sometimes the next day for about a day or so. You could potentially have a fever, and you may just feel sort of really run down and like you've got the flu. You don't have the flu. The virus, the vaccine cannot give you infection because it's, you know, it's not delivering live virus, so it can't cause the flu, but it will give you symptoms because your immune system is doing what it's supposed to do. It's learning what that is and training itself to mount a response. So it's actually indicative of a term that we call immunogenicity. If it's not causing an immune response, then it may be less likely to work in theory. So the immunogenicity effects, or those symptoms, are actually really expected and normal.
Okay. Now, Dr. Estelle, I took the flu shot, like I told you, and I did have pain in my arm for maybe, I want to say maybe a day or two, and so did my mom. And then I heard my daughter's 3. She was like, "Mom, my arm," for like a day, but it did go away, you know. So I didn't have anything besides a little soreness at where I actually got the shots. But now, in regards to the corona vaccine, I know a lot of people don't know a lot about it. The FDA just approved it last night, or not too long ago. And people are really worried. I mean, especially in the African-American community. This is the demo that we mainly serve. And we don't feel real confident in taking this vaccine. And so what do you have to say to the public in regards to that, as far as taking the coronavirus vaccine?
Yeah, those are excellent and important questions and concerns. And so I guess I'll sort of make a couple of comments. So the first one is that the new Pfizer vaccine with BioNTech it's not FDA approved yet. So that's a really important thing to understand. It got approved, it's not formally FDA approved in the formal sense of the term. It received an emergency use authorization approval, which is a special provision for exactly the situations that we're in right now, pandemics, health situations, to allow the use if the safety data is appropriate.
Okay.
And so what has occurred is, the Pfizer and BioNTech, they conducted really large clinical trials, phase 1, 2, and 3 have been conducted so far, and they're still ongoing. And all of the data from that, so they actually had more than 38,000 participants in the safety study that they conducted. And in the safety data that was available to date, is there's really been no concerning adverse effects that would change the risk-benefit profile. So what we look at is the known and potential risks greater than or less than the known potential benefits of the vaccine. And the data that they gathered in looking at all of these participants was demonstrated that this vaccine has a 95% efficacy after the 2 doses have been completed. So remember, it's a 2-dose vaccine.
Right, right.
And so you got to get both. But then the safety profile was actually really, really good. There were a lot of people having those symptoms of, pain in the injection site. Yeah. There were a lot of people having muscle pains, like just feeling ill, actually. And there were a lot of people feeling fatigued, and a fair amount of them having fever as well. So again, that's that immunogenicity reaction that should be expected, but shouldn't deter people from getting that second dose. A group of independent scientists actually reviewed all of that data and have determined that it is safe to do in 16 years or older.
So it's for 16 years and older. And I did see that some people are saying, and I don't know if you've even heard this report, that if the vaccine has caused some people to get Bell's palsy. Not quite a few, but some people will get that, and it's a temporary like stroke in the face, or where your face is not moving on one side, and there's not enough research on that. So a lot of people are deterred from taking the coronavirus vaccine because of these new reports.
Yeah, so that's a great question. So when they looked at that, and they did see there was a number of them that occurred in that vaccine group as opposed to none in the placebo group, which raises concern for, is this going to be something that is real or not? When they look at the occurrence rates of that particular entity, Bell's palsy, occurring in the normal population, and what those rates are, the rates that occurred in were actually consistent with normal rates in the population. Therefore, they're not it's something that they're watching. They're going to have very specific tracking of all of that. But at this moment in time, it appears that it probably is occurring at rates that it's because it does happen in the normal population as well.
Right.
So
okay.
Really close.
I see. And what about pregnant women? Should they wait to take the vaccine, or should they go ahead and get it to be safe? And that's in regards to the flu vaccine or the coronavirus vaccine.
Yeah, so regarding the flu vaccine, everyone 6 months or older, including pregnant and not pregnant, medical conditions or no medical conditions, should get the flu vaccine. It's approved and safe for all who are 6 months and older. And we actually especially recommend it in pregnancy, the flu vaccine. So with COVID, as you may have known, some of the data that CDC has released in the MMWR is indicating and concerning that pregnant women are at increased risk of hospitalization and requiring ventilators with COVID-19. So that's a particular population that we really would want to vaccinate. The trouble is that the pregnancy was excluded from those clinical trials. Now, there were some pregnant women in it because they became pregnant after they got in the study, and they didn't see any issues with them in particular, but there wasn't enough of them to have data actually comment on that. So the answer right now is there's not likely to be a recommendation to specifically administer it to them, but there's a lack of data in that population in terms of safety. So I think really each woman and each really family unit with their physician
Mm-hmm.
is going to have to discuss that on a case-by-case basis
Mm-hmm.
for them.
To see if that's the safest thing.
Yeah, because there's
Mm-hmm.
just not data to comment
Mm-hmm.
really.
Right. And I must ask, because even I've had coronavirus test, and I was surprised that when I got the antibody test, it said I had antibodies, right? I was sick back in February and I didn't know what it was. And apparently that's what it was, because I have the coronavirus antibodies. And so for a lot of people who have already had the coronavirus, they have antibodies, and they feel as though they don't need to take this vaccine. How would you advise them in regards to this vaccine?
That's a really good question. And the reality is we still want to really see more data come out about that. But right now, given the good safety profile that we've seen based on the 38,000 participants over a 2-month period of time, and that it's been demonstrated that people can get infected again,
Mm-hmm.
suggests a waning natural immunity. Right now, the study included individuals who had past infection. I would say if I had COVID before, I would still get the vaccine personally. Again, that's going to be a case-by-case sort of decision for each individual, but we do suspect that there probably will be benefits, but there's just not totally enough to really sort of make a blanket statement like that.
Mm-hmm.
But with the hope is that the vaccine will actually provide higher levels and more durable immunity than natural immunity.
I see. And so for people who are, like I said, this is a hot topic, around, can't say kitchen tables, but on social media. It's a hot topic on social media when you're talking to your friends just one-on-one about this vaccine and the fact that it just came out. And so there's a lot of people who just, I guess they want to just test the waters and see how it goes initially with so many people. And then they want to go ahead and take the vaccine. But, once the vaccine does start to roll out, when do you think things will start getting back to normal, right? I still work from home. I come up here only so often. My daughter can't go to school. When do you think things will start getting back to normal when I can go on vacation without my mask?
I don't have a crystal ball, but it's going to take several months to get so there's that period of time. Also, you have to remember that we really need the majority of Americans in the community to get the vaccine for it to really, really have its effects and benefits. So my hope is summer we'll start to see really some improvements. I don't know about going back to normal. But I think by summer we should start seeing some of the benefits from the vaccine and the like. And it's also really important for people to understand that even once you get the vaccine, you still need to wear a mask. You still need to physically distance and do these measures until we get most of the community vaccinated and we start to actually see the transmission rates.
That is starting to go down. And the vaccine is only for people 16 and older. That concerns me because the small kids still need to go back to school. And so, that's just something else that we're going to have to worry about when we get to that point. But, Christmas is right around the corner and people gathered for Thanksgiving, even though they weren't supposed to. I know personally because they got coronavirus right after Thanksgiving. And it's like, surprise, what did you expect? So I know people who are dealing with the coronavirus now due to them gathering at Thanksgiving. And so Christmas is right around the corner, and I know you want to get together with your family and friends, but can you just stress the point of, you know, let's be safe this Christmas so we can have a next Christmas?
Yes, 100% agree. I think one of the silver linings, for lack of a better term, is learning new ways to connect with people and new ways to do what we do and gather. And so I think, you know, I recommend take it on as a challenge of, hey, how can we celebrate the season in a way that still feels true to our traditions and togetherness, but is safe. You know, and safe being not doing a giant group of people, smaller, keep it to your nuclear family, those who are already in your household. And if you have a few other family members over, that you mask. And that when you're sitting down to eat, that you sit 6 feet apart. You know, if you're not living in New England, you know, we're in Texas, so we're lucky. It might be, you know,
go outside.
Not cold enough to go outside, or even open the windows and increase sort of that airflow that's coming through the house, and not have everybody stay all day, you know, having it be a period of time. And I think that you can do togetherness, and it's in a safe way. But just make a distance, wear a mask, and make it a little shorter than
right.
But it's, you know, important. You know, I think it was a meme. I hate to sort of repeat a meme, but it was, you know, better a Zoom Thanksgiving than an ICU Christmas. And I think that is so true. You don't know if you're going to be the one who gets the severe disease that lands in the hospital or not. Yes, most people get mild disease. That is true. But you just don't know if you're going to be that one or your loved one is going to be that one.
Absolutely. And you don't want to be the one that gave it to them, right? So I just practice more safe than sorry is what I do, even though I have antibodies, I have my mask, I put them on all the time. And, you know, so we are very safe over here, especially with my family. So I do encourage everybody else to be safe as well, because I tell people all the time, I love you and I want you to make it until this whole thing is over and we can talk about it and laugh about it, how we made it to the other side. So that's the goal, is to make it to the other side. And, you know, I just want to thank you, the doctors and all the nurses. I know you guys have been working 24/7 for almost a year now, and it's not ending. There's no end in sight. And we know that the doctors and nurses, you know, they're doing God's work is what I say, because people are in these ICUs by themselves and they're not there with their families. And these nurses and doctors have to call the family members and tell them bye and all this different stuff, and infect themselves, or, you know, can't be with them families because of this. And so we just want to thank you for all the work that you're doing as well.
Thank you. And thank you for being such an amazing example, you know, by standing in, you know, your actions in pursuing safety for you and your family, because you're a leader in the community. People watch you, they see you, they know who you are. And so thank you for doing that, and for getting, you know, facts out, the truth out. And, you know, I do want to sort of, I guess, praise a little bit, you know, the FDA and the groups, because they've been really transparent through this process. Everybody wants to get all of this information about, you know, those clinical trials. You've read it. Any person can really just go onto the website, get all that data, and you should it. And if you don't want to try to wade through all of that science, they've done a number of press conferences and the like, and you can really get that information. And that's been the goal, because we know that there's a lot of stuff going on, and we want people to hear what's been going on and know that safety is being put first.
All right. Well, thank you again so much. I'll have to bring you back on the show, but I appreciate you so much. And let's get this vaccine and let's get back to normal. Thank you.
Thank you.